It's now a pleasure for me to introduce the director of SHARE. So I'm feeling pretty honoured myself, but there we are, Professor Brian McKinstry. So Brian, very, very warm welcome, who is, as you can see from the slide in front of you, a general practitioner, a Professor Emeritus in Primary Care and eHealth in the University of Edinburgh, and has a pretty stellar career with interests around remote information, thinking about how clinicians and patients can communicate, and of late has started to move more into the area of eHealth and telehealth care. He's the clinical lead for Scale Up BP, which is looking at implementation of telemonitoring, for example, in hypertension. But Brian, this is very much your home ground, and it's a delight to welcome you to the symposium this afternoon. Over to you, sir.
Right, well, I hope everyone can see my slides, can they?
We can see them perfectly, thank you.
That's great, okay. So I'm just going to talk very briefly a little bit about SHARE today. We were aware for a little while that maybe people weren't making as much use of SHARE as we'd like, and so we commissioned some work around this about what researchers thought about SHARE and what they wanted us to do differently, and we're going to talk a little bit about that today. So if I can just get a slide to move on. So there's a paradox here, and this is why SHARE was invented. Researchers can't contact potentially interested participants, and potentially interested patients don't know that research is going on. And this is the reason that SHARE was invented. So for those of you who don't know, and I imagine many people are attending today do know about SHARE, but just for those of you who don't, SHARE is a register of people aged 11 or over living in Scotland who want to help with medical research. They've given permission for the codes in their NHS data sets to be used to establish whether they may be suitable for different types of research product. And quite a lot of people have also agreed to use leftover blood. So when you give a full blood count sample, but much of that is not used. And if you're given permission, then that is stored and it can be used particularly for genetic research. So SHARE has got almost 300,000 volunteers at the moment. It's one of the biggest volunteer cohorts like this in the world. Most of these people have given permission for their blood to be used as well. So we've actually got 170,000 plus in storage at the moment. So if you're interested in doing research with SHARE, we will actually provide a free feasibility service. You just have to come along and tell us about your project, and we will try and find out whether this is something that SHARE can help you with or not. And we not only find people, not only find potential participants for people, but we also actually can help triage for this. So if people have got fairly sophisticated eligibility criteria, our staff can sieve through patients to start with, our participants, to find out that to hand you the most suitable ones. So as I said, we were wondering why perhaps we weren't being used as much, and we asked Sean Trevick from Aberdeen University to explore this with researchers in Scotland, and Sean did this over a period of around about 3 months with his colleagues Hannah and Senga, and they produced a really helpful report for us. Now Sean is going to publish this work, and I don't want to preempt it by going into too much detail, but I'm going to talk about the highlights of it. The first thing, which was very positive, was that everyone that he spoke to thought that the idea of SHARE was good, but that there was a lack of clarity about how it worked, what exactly it did, who it could help. And some people were concerned that SHARE was not very representative of the Scottish population, and they were also worried about how SHARE was priced. So in response to that, we actually have done our best to improve our website, and so we updated that. Now there's whole new pages now for researchers, and you can click on this and see how you go about applying for SHARE and what we need from you before we can help you. And there's an interactive tool there as well, which gives you some idea of the types of people that are in SHARE. We can search on the whole variety, obviously, of clinical conditions, but also on the drugs that patients are using. And that's important because not all conditions are very well recorded. For example, migraine is a very good example of that. It's often not coded well in GP records and often doesn't present in hospitals. But you can search for them using specific anti-migraine drugs, for example. So we can do quite a lot with this. However, if you wanted, say, for example, just to do research maybe in Lothian or in Glasgow, you can actually on our website go in and find out how many people you've got with a particular problem in that area. So, for example, if you wanted to do research on heart failure in Lothian, you can see here that we've got just over 1,000 people with heart failure in Lothian who've signed up to share, and you might want to combine that. So how representative is share? So one of the things that came back to Sean's team was that people felt that, yes, the sort of people who are signing up there are not the sort of people that we're really interested in. We're really interested in maybe people who are poor, who are maybe not so literate. Many people wondered just how good we were at that. And this is sort of things they're saying. My feeling that it's only people who've got time to take part in this, who are retired maybe, or see the point or convinced. And will ethnic minorities take part, and people who have maybe got more issues that we are interested in. So we looked at this. So if you look at the age distribution of share, it is actually quite diverse. Now, of course, we do have a clustering in the 60 to 80-year-old group, because that is the group of people who attend hospital most frequently, where we did most of our recruitment. And also, of course, these are the people that are often of most interest, though, to researchers, because these are the people who have the conditions. But as you can see, we have really a very large number of younger people here too, many of whom are healthy. And share is a really very good place to actually recruit people as normal controls, because we have a lot of people with no health conditions at all as well. And we're not alone in this. And if you look, this is a very old slide now. This is when Biobank was set up, UK Biobank. And as you can see, they had a very similar distribution of age when Biobank set up. Obviously, this has shifted quite a bit to the right now, as Biobank is almost 20 years old, and these people have got much older. But it just illustrates that share is not alone in largely recruiting older people. With regard to ethnic minorities, share does really well with this. Actually, we put a lot of effort into trying to make sure that ethnic minorities were represented. Some of our recruiters parked themselves outside mosques, for example, to try and include people of different ethnic backgrounds. And in fact, now the ethnic population in share actually exceeds that in the census in Scotland. And again, one of the other things that's being mentioned is it's only rich people that will join share, that it's only people who are maybe more articulate, or better read. And a lot of researchers say the people they're interested in are the people who are struggling in life. But if we look, this is how Scotland looks across the board in terms of deprivation, in terms of deciles. And if you look at share, you see it's actually very similar. There's a very slight bulge in 4 and 5 there, but in general, we have people from right across the divide. And we did wonder why people thought this, but in fact, if you look at Biobank, for example, when the way they recruited was quite different from us, and as a result of that, they actually do have quite a heavy representation among the wealthier people in the country. So again, another worry was that we don't have people in rural areas, and that most of these people will be in Dundee, Edinburgh, Glasgow. Well, of course, that's where all the population is, and so we do, of course, have more people in these areas. But we do have people throughout Scotland, and although it would be difficult for you to say to run a randomized controlled trial in heart failure in Orkney, there are plenty of research that could still be done there. Cost was a concern for a lot of people. Using this share resource will cost too much. It's probably fine for well-funded projects. But in fact, we only recover costs. Share is not a business. It doesn't aim to make a profit in any way. And we offer a free feasibility. So if you come along and tell us what you want us to do, we'll tell you roughly what that's going to cost. And that's particularly useful if you do that before you apply for grants. And the quotes that we provide, we pretty well stick by. Unless something very, very strange happens, we nearly always stick with the quotation that we give you. This is a good example of this. So Chariot Pro was a very sophisticated dementia study. They were setting up a cohort of people who they thought were at risk of developing dementia. So this was a big ask of people. We invited people to take part in the study. These people had to agree to almost 3 days of cognitive testing, a CT scan, and either a PET scan or a lumbar puncture. So asking a great deal of people. We approached nearly 1,500 people. 700 agreed to be screened for this and were sent along to the researchers. Now, in the end, only 91 of them were found to be at increased risk of developing dementia. But in fact, it was quite an achievement for us to deliver this number of people. And in fact, Scotland was by far the best recruiter in Europe in this study. But typical study costs, if you want to do something simple like a survey and you're not, it's a fairly indiscriminate one, you're not particularly focused on any particular group, we can set this up and send it out very, very cheaply for you, 70,000 emails for about £7,500. And if you want to narrow that down, say narrow it down to people with COPD or people with COPD in a certain age group, it costs a little bit more than that, but still much, much cheaper than the traditional ways of sending out questionnaires. Selecting people for studies, for randomized controlled trials, or even qualitative studies as well. We have a patient fee which varies, and that varies because of the amount of work that it takes. So if, for example, you want something very simple, you just want people just with COPD, then that is very inexpensive for us to do. If, however, like Chariot Pro, you had to make lots and lots of exclusions, for example, find out whether people had had treatment in the past for depression or whatever, then this all takes a lot longer, and so it becomes a little bit more expensive. But this is agreed in advance, and as I say, in general, once we've agreed it, we very seldom change it unless there's a big change in what you do. Commercial studies cost a little bit more because eligibly funded studies have already paid for share to a certain extent, and so they are subsidized for that. However, we have never had a complaint from a commercial partner that we were expensive, quite the opposite, in fact. So in conclusion, SHARE is a representative cohort. It's easy to explore for likely eligibility. You can just do that yourself on your computer. It's relatively low cost, we feel, and it's likely to be an asset to your study recruitment. So finally, if you're interested in using SHARE, we'd like you to contact us before you make grant applications. You don't have to, but we think it's better if you do. We would strongly, strongly advise you to always add SHARE as a potential recruitment source to all of your protocols and IRIS applications. We get a lot of studies who are struggling to recruit that come to us to ask for help later. If you've already done this in advance, if you've already put this in your protocol, then you don't need to go back to ethics. We can just help you without any further ado. So we'd like you to check out this new website as well, please. And we're always welcome to get feedback. So if you're having problems with SHARE or there's something you would like us to change, we would be very, very willing to hear from it. Thank you very much.